I'm Susan Taylor with Scripps Health in San Diego, California. This is something most folks don't want to talk about, but not talking about it actually could put your life at risk. We're talking about colon cancer and rectal cancer. According to the American Cancer Society, colorectal cancer is the fourth most common cancer diagnosed in the United States, and roughly 53,000 people die every year from this disease. So having that conversation with your doctor could save your life because this is often a preventable disease. Joining us to talk about this is Dr. Walter Coyle. He is the head of gastroenterology at Scripps Clinic in La Jolla, California. Doctor, thanks so much for being with us.
Oh, thank you for having me.
So colorectal cancer affects how many people in the US every year?
Roughly 150,000 people develop colon cancer or rectal cancer every year.
And what are the signs and symptoms?
Well, they're often missed, but they can be subtle. So bleeding per rectum, you can have pain in your belly, you can have a change in bowel habits, and weight loss. They're probably the major ones you look for.
And how do you know that that's something serious as opposed to, let's say, you've had, too many bananas or too much rice or too much fiber?
Well, a lot of people will blame hemorrhoids. They have bleeding, it's just my hemorrhoids. And that's the big trick. And that's why if you're not sure, you should see your primary care doctor, who may refer you to a gastroenterologist, and they may need to do additional testing. The problem is now, if you're 30 or 35 years old and have bleeding, it could be a sign of early colon cancer. We're seeing it in much younger people now.
Why is there an increased incidence of colorectal cancer among younger people?
We're not 100% certain, but we think it's something we've done in the environment. Processed foods, antibiotics in our food source, and our microbiome. But definitely people who are born after 1990 have a higher rate now of getting colon cancer early on. The biggest risk factors seem to be family history, but everyone in the United States is at risk, regardless of family history.
So who's at a higher risk for getting colorectal cancer?
Early on, men are at higher risk. African-American descent is those who are obese, don't exercise, people who predominantly have a diet high in processed red meats, particularly charcuterie and those type things.
And what about inflammatory bowel disease?
If you have any inflammatory condition of your colon, that increases your risk, and your doctor should advise you when to start getting your colonoscopies.
So how do you screen for colorectal cancer?
There's two basic ways now. We can do colonoscopy where we directly look, and there's stool-based testing at this point. And they're the best ways. They've all been shown to decrease your chance of dying from colon cancer.
So what does that colonoscopy entail?
Well, the colonoscopy, and I have a scope here I can show you. This is what the scope looks like. And actually, there is a working channel inside the scope. We can actually take biopsies, we can take pictures, we can wash, and we can suction away debris, and we can actually physically look at your entire lining of your colon. And if we see polyps, we remove them. If we see cancer, we diagnose it right then and there. The advantage of colonoscopy is we prevent colon cancer by taking polyps out, and we can diagnose colon cancer. The problem with the stool-based test is sort of waits you either have cancer or a very large polyp and then finds it, but it finds it earlier. But of course, it's less invasive and less expensive.
And for the colonoscopy, are you sedated for this? Are you kind of out of it?
Yeah, we're using two kinds of sedation, either moderate sedation or even propofol anesthesia in some patients, yes.
So if your doctor finds a polyp, does that mean that it is precancerous, that if left untreated, this would actually turn into cancer?
That's a great question. About half the polyps are what's called hyperplastic, which would have never gone to cancer, and the other half are adenomas, which are precancerous. Now, just because we take that out doesn't mean it would have definitely become cancer. We're not that good yet. So we take out all the polyps we see, and by doing that, decrease your chance to get colon cancer.
So they say this is a preventable disease. How do you prevent colorectal cancer?
Well, people always ask me this after I find a colon cancer or polyp. What I usually recommend is they reduce their weight, exercise regularly, that's at least 3 times a week with their heart rate over 100. And then certain dietary things are very helpful to reduce your risk. Drinking coffee reduces your risk, so does taking vitamin D, and avoiding red meats, especially the processed red meats.
So if the polyp is found and taken out, does that still put you, though, at an increased risk down the road for the colorectal cancer?
If you don't have any polyps, our screening is every 10 years. But once you have polyps, we then screen more frequently, 3 years, 5 years, or 7 years, based on the guidelines for how big the polyps were and how many polyps there were.
So if you end up with colorectal cancer, what is the treatment?
It's all based on the stage. If it's an early stage cancer, we can take it out by the scope, or the surgeons can cut out that part of the colon. And if there's no spread, you're cured just with that. Once we find it later, you may have to get chemotherapy, radiation, and immunotherapy, which can be very difficult to undergo and may not cure your disease.
And what's the survival rate?
It's very good. If we're stage 1 or 2, we're over 85% 5-year survival. Once you're stage 3 or 4, it drops dramatically down to about 50% 5-year survival.
At what age should you start getting tested for colorectal cancer?
45 is the new 50. They've moved it down from that time frame because we're finding earlier cancers. The exception is if you have family history. If your mom had colon cancer at age 50, you should get your first colonoscopy 10 years earlier or age 40, whichever's earlier. So like age 40 or even 35.
And in terms of colorectal cancer for younger folks, are there different types of symptoms?
Exactly the same symptoms, but because they're young, they tend to ignore them, or even their physicians sometimes don't always do a rectal exam or think about the possibility of colon cancer. But that is changing. We're educating all the primary care doctors that this is a disease that we're seeing in younger and younger people now.
And how often should you get that colonoscopy?
Well, we start at age 45. If we find no polyps, it's every 10 years. If we find polyps, it'll be 3, 5, or 7 years based on what kind of polyps we have.
And when should you go see a doctor to talk about this? Because everybody's kind of squeamish about talking about this subject.
If you have no family history of any GI diseases, it's fine just to wait to age 45. However, if you're having pain, bleeding, family history, you should see your doctor sooner to address those issues now so we can plan on when we should do our screening.
Any final thoughts, doctor?
This is a deadly but preventable disease. It takes 10 years to develop. Any time in that 10 years, if we find that polyp, we stop you from ever getting colon cancer, needing any chemotherapy or surgery. Think about it. It's the #2 killer of men and women in this country, and we can prevent it.
Dr. Coyle, thanks so much for being with us. We appreciate you taking the time.
Thank you very much.
If you want more information on colorectal cancer, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.